You're listening to the Best Morning Routine Ever podcast, the show that proves no one stumbles upon success ever. With your host, Lou Need. Every Mondays and Thursdays, we deliver cold hard evidence behind the power of a robust morning routine. Get ready to be transformed by the renewal of your mind.
Hello, morning enthusiasts. Welcome to the Best Morning Routine Ever podcast. I am your host, Dr. Lou Need, and today I have the honor of introducing a special guest to the show, Brandy Burch. Now, Brandy is the trailblazer, founder, and CEO of benefitbay, a pioneering company revolutionizing employee benefits and health insurance. As a single parent from a non-traditional background, Brandy's authentic journey to the founder's seat offers invaluable insights for diverse audiences. And so I'm excited to have her on here just to talk about what her work has been like and how her background really got her to this point. So with no further ado, Brandy, welcome to the show.
Oh, thank you for having me. I'm excited to share my journey with others and hopefully motivate them or inspire them that they can reach those heights.
Yes, absolutely. It's such an honor to get trailblazers on here. So let's start with what got you started down this path as a single mom, having gone through to actually be revolutionize this journey.
Yeah, I think start out with the desires to be a single mother by any means. I had a child at 17 and married her father when she was 3. And we went on to have a big family, a large family. And unfortunately, we went through a divorce 17 years later. So in a journey for me was part of that adversity was continuing to push through with my career, even though I was facing hard things or, stepping back in certain ways, inability to travel due to having that co-parenting type of dynamic, and just really taking those steps to make sure that I could have that work-life balance, but also continue to drive forward in my career, the things that matter to me. I think that that's the journey I landed on. And I think so many of us maybe have a different plan for our life, and then we get on course, and it doesn't mean that those few bumps can't keep us from getting to the end journey that we had desired for ourselves.
Yeah, and not forgetting our wants and our desires, right? Because a lot of times we get into parenthood, we get into relationships, and we just kind of put ourselves aside. As women, as entrepreneurs, we just forget about what is it that we're looking for. And then once the kids are all grown up and the divorce happens, we don't know who we are.
Well, there's a journey there too.
So it's nice to see that you took in the first pedestal and say, this is how it can be done, and you can have that life that you still want, despite of that. So tell us about benefitbay.
Yeah, the journey to benefitbay was as well just a career journey. I've been an operator or an accountant all of my career. I like to say an operator because I didn't just come at it from the numbers. I understood business and how the humans as part of that business make that business successful. So driving those performance metrics that make people happy to be at their job, they will perform better. And that's always been something that motivated me. And benefits are key to that. So that's kind of where that resonated at each and every role. Is a human is motivated by the benefits of that employer. Those benefits can be their actual medical benefits. Those can be their work-life balance benefits. Those can be the give and take and flexibility to be a mom and be able to be at the soccer game or the volleyball tournament over the weekend, right? But still be able to perform and deliver at the level that you have the capacity to do. So benefits had been something that I had utilized throughout my career to motivate humans, and they'd also been a thorn in my side. So benefits continually go up in price. They continually go up in price for the employee at the end user seat, right? And so it's something that created a lot of pain for me that we would have to increase out-of-pocket costs for our employees. I would know what that was going to do to them, but the business may or may not survive if we don't do some type of cost sharing on that benefit increase. And so I have wanted to make benefits better. I have wanted to have some type of control regarding that spend or that budget year over year so that you can actually make a plan and stick to it. In US benefits, you can't do that right now on the group side of the business. You get a renewal 90 days from the termination date, and it's a huge increase. And it's based on someone within your employee population had a health crisis, had a premature baby, had a cancer diagnosis, had to go through some exploratory test. And suddenly now the budget of the company and for all of the other employees of that company is affected. And I feel like that's just, it's wrong. It's not something that I enjoy about our benefits ecosystem. And until 2020, there really wasn't a way to look at it differently. In 2020, some favorable legislation passed called ICHRA, and it's a acronym that often people can't find if I don't say ICHRA. It's Individual Contribution Health Reimbursement Arrangements, and it allows the employer to now define a contribution that's fair and equitable to their employee members and allow those employees to go out and shop for their own insurance and for what matters for them. So if I'm someone who's really in my child rearing years and our kids are going to the doctor all the time, and I just want to be able to have a zero copay when I take my kids to the doctor, I don't want to write a $165 check or use my debit card for $165 to meet some large deductible that I'm saving towards an HSA in my future retiring years. Right. That's not a world I'm in. Then I can pick the plan that's zero copay for me and zero out of pocket of my paycheck. But if I'm in another world where maybe I'm highly compensated, I'm not seeking the doctor very often, I just want a salary deferral and save until those years where I may need that health savings account. I can make that decision for myself, but it's not for my employer to make that decision that's best for me and my family. You don't know what situation I have from a health implication. I don't want you to know what type of situation I or my children or dependents have as a health implication, so that you're not going to make a decision about my future with your company based on a health risk or something that's going to drive up cost to your company. And unfortunately, those are things that businesses do, even though it may or may not be legal. People think of humans that drive up cost when they're making decisions to cost cut in the future or reduce forces, or they're making those budgetary decisions. And I want those things out of U.S. benefits and out of healthcare in general. Healthcare is a personal item. We should be able to keep that information to ourselves, not have our employer deciding what drug contracts to do and, where I should and shouldn't seek care and what type of carrier I should utilize or what type of network should be available to me.
Yeah. And the thing you mentioned seems to be more common, right? The latter would say the individual who, let's say, that's not highly compensated. That's the more common scenario. So it seems like the employee is not thinking about things. It's not in their best interest, the common person, the average Joe that is sitting in that seat.
I mean, often the decision maker at the employer is your CFO or is your chief human resource officer. And they come at that decision with a set of biases that are more regarding what is something that they would enjoy or that is important to them. And they don't necessarily come with the same level of experiences as that other employee, or maybe even the majority of that employee population. And we're seeing often with benefitbay that when employers move to this, they had objections to moving to ICHRA. They thought, their employees are going to have a hard time making their own decisions. This is going to be something that's, over their head. As employees, we make our own retirement decisions. We're suddenly stock experts, but we can't make a decision about our own health, something that we actually have the capacity to make that decision on. And there's resources available to help individuals make this decision. There are licensed counselors within benefitbay that can help individuals ask their questions regarding their specialist and their drugs. So let's give the employee the keys to the car or access to those dollars so that they can spend them the best way that makes sense to them. And it's based on legislation that was able to favorably pass. And then it was also in 2023, it was further strengthened by the Biden administration, in which they made access to Family Glitch and made it to where if I'm an employee and I have an affordable contribution, my employee or my spouse and my children can still access those subsidies instead of harming a family that may be subsidy eligible by defining a very small affordable contribution, and they're suddenly knocked out of healthcare for the larger family unit at a much higher price. And so all of these things have been looked at, I feel like, in the last few years, better for the consumer, right? Those dollars are your dollars. In the most of the scenarios, we're giving those dollars from our paycheck, right? And then they're being invested by our employer in some type of group product decision. And we want to make sure that we can have access to those same decisions and drive change. I think carriers haven't been held accountable for a really long time on providing customer service because someone made the decision for us at a different seat. They just needed to keep them happy. But us as an individual, we could have called that line, waited on hold for an hour and a half, and they didn't care. They could deny our claim and they didn't care unless someone with higher power advocated for us. But when we finally are able to make the decision in masses, carriers will care about the individuals making the decision. They will market to us. They will develop plans that matter. They will look at those types of scenarios that people care about.
How do we go about driving that change? Because we're talking about, that's it's a big ecosystem to penetrate.
It's a big ecosystem to change. So benefitbay is trying to change the ecosystem within the ecosystem. So we have a sales tool that works for brokers to evaluate that employer population and whether or not individual benefits would save that employer and their employees money. So I'm still tried and true to, we do not need to drive up the cost of healthcare. If ICHRA will increase the cost of that population, do not put it in place. No one in America needs more money going towards our healthcare, right? For lesser benefits. Yeah. So let's first qualify that in the front end. There are still a few states that individual coverages or individual ACA off exchange plans are more expensive than group, but 31 of the 50 are more reasonably priced than group. So we should be showing that massive shift towards individual choice. There's some things that's slowing that down, and that are those decision makers at those employers. Resistance to change, it's new, feeling like they may lose a little bit of control. At the broker seat, similar, it's something that's new. They may lose control. How do I add value when now a benefitbay is in the middle and maybe the employee starts to build a relationship with benefitbay and choosing their decisions and the employer does? How do I still add value as a broker, and how do I receive compensation? I think that when more and more employees start asking their employer for choice, the employer will be motivated to continue to drive this change forward. I think as well, when more and more employers are asking their brokers, why isn't ICHRA being presented at my proposal each year? Then we'll start to see the movement at the agency side where ICHRA is proposed each year alongside those other products. And may the best product win. If ICHRA is the best product, let's get the employees in ICHRA. If it's group funded or self-insured, let's get them in what's going to drive the cost down and be responsible for that end user.
Yeah. And why is it so expensive? That's the $1 million question.
Why is so expensive?
Yeah. And I feel like it's been asked over and over again, and still we haven't had the right answer.
Yeah, I think healthcare is so expensive because there hasn't been competitive advantage. There hasn't been transparency. And I think that the carriers have gotten a bit egregious at owning a lot or multiple parts of the ecosystem. They're able to deny claims in creative ways. End using employees don't actually have access to that coverage that they thought they had. And the income was not limited to the carriers. It's not regulated. And therefore, every dollar they save is a dollar they keep. And that motivation is not the motivation that should be in the market. ICHRA solves for that as well, because on ACA products, there's a maximum revenue that can be earned in the off-exchange plans for these carriers. There's a risk sharing and there's a revenue, basically max or cap on these programs. And so those rates have to be able to be rated effectively based on the age of the individual in their zip code. And because you're not rating for the massive United States of America network for a large employer who has employees all over, and because you're taking Medicare eligible employees and you're putting them in Medicare and off of the group product, you're going to, by effect, drive down cost savings. And then in the long term, when an individual cares about their healthcare because they can get control that cost for them as a human, I think will drive individuals making better healthcare choices.
Yeah.
So I think that's how we make it better, but it's gotten way off track for the last, it's going to take a minute to unwind it. I think it's a slow moving train, but we did see more adoption last year than we've seen in the last 3 years. I think it was 4x of the prior years. Us ourselves at benefitbay, we put on the number of lives in the month of June that it had taken us 3 years to do. So it is absolutely driving. It is driving in a massive adoption manner. A lot of those renewals that are coming in throughout the year are coming in high again. And ICHRA is now kind of a known thing out in the market, and employers are asking for it. So I'm excited about that to continue to evolve. And we're getting out there and telling the story. We're educating at SHRM or educating at manufacturing associations or educating at school district superintendents, school boards, right? And trying to get the knowledge out there. If their broker's unwilling to bring it to the table and they're looking to them to consult them and educate them, then we need to get out there and educate the market so that they know to ask for it. Yeah. And so we're taking kind of a drip campaign, even doing these type of podcasts, is how do I get out there to audiences that I maybe wouldn't otherwise have an opportunity to, where they will know that this is something that is an option out there. Maybe they're in a decision seat. Maybe they're in an influencing seat. Maybe they're just going to go ask and knock on HR's door and say, why are we not looking at ICHRA? My healthcare is too expensive and I would rather have a product that serves my family. So I think that it's just challenging everyone to think of outside of the box. Anytime there's been a disruption in any market is slow. So we used to all be on pensions. We are all now on 401k. We are able to control those dollars rather than our employer maybe investing them or having some type of fraud activity happen with our dollars that we invested 30 years with a company. That's no longer a capability that can happen. So we know that this will drive through change. It's just going to take some time. Defined contribution when it came to retirement took about 12 years to really take off. So we're only 4 years in. And the technology isn't 100% there yet. So the technology is there to help an employee decide. The technology is there to help an employee enroll. The technology is there to quote. But on the back end with the carriers, it's still, for those of us who are playing in this technology space, a bit of an antiquated process to get the carriers these enrolled applications. And so we can't drive our costs down until they get to a technological innovation to where they're receiving all of that electronically real time. And those dollars flow real time, rather than currently with some of our carriers, we submit an app and then 24 hours later, you can go in and make sure it was approved. Okay, maybe it's 72. Then you can make the payments and then you can go set up an auto payment. And so I have to touch that employee member's account 4 or 5 times just to get it set up appropriately. When we can move that to a technology, then the fee that benefitbay charges that employer can go down, right? So those are the types of things that are going to improve the space. And I think transparency is key. CMS passed that individuals can see their own medical records. They can make their own medical decisions based on that data. Now, when they can choose their own healthcare plan based on that data, they can start to make really smart decisions for their families. I think we're going to see it be much like TurboTax and H&R Block for healthcare. Almost any of us can do it. And from our kitchen, from our couch, from wherever, with our family members there helping us make the decision.
Yeah. I love that there's the education piece of it, that you're educating and letting people know that they can take control over this. They can be in the driver's seat of this. And I love the autonomy. I love the ownership that comes with it, because a lot of it is just blindly going through it and somebody telling you this is what you should do. You're like, okay, these are my only options. I must take those.
Yeah. And can we get women in for their mammogram because it's free? Like, can we nudge them and tell them, like, go make this appointment? And can we get them in there for their, colonoscopies if they have health risk? Like, let's also drive positive change in healthcare, because humans aren't going to the doctor because they can't afford the out-of-pocket cost. They're on high deductible plans and they don't have the money to go and pay for that visit. So they're letting their healthcare go. And we need to take that charge back and take care of ourselves.
Yeah, and it's no small feat what you're doing, but it is feasible. It is possible, because let's think globally. Let's think globally. Let's think outside. Let's think Canada. Just go up north for a little bit, right? Let's think Europe, Switzerland. Like the benefits, like the time off just for maternity is, you had a year, 2 years off, paid, covered. Like, it's been done. It can be done.
It can be done. And it's done in all other countries at a lesser cost, at a better health outcome. And so how are we the most expensive with the worst health outcomes? And how is that on a continued decline, right? We shouldn't have that in the US, and we do. And so this is a way that we can start to drive change, and it's not going to happen overnight, but absolutely out here driving the change towards personalizing benefits. Our workforce has changed. Our how we live has changed. benefitbay is a remote workforce. I'm on your podcast from my basement in Kansas City. My 26 team members sit in 18 different states, and we don't have to all sit in the same states any longer and be in a remote or be in a brick and mortar office that we go to. So our healthcare also can't be just seated in one state, because we're all over. So we need those choices. What's accessible to me in Kansas City sometimes is a completely different carrier brand that really owns that market and has great experiences and great pricing than what may be available to my coworker in North Carolina, right? So, and all of those things are something of the product of how we've evolved. And that's also what's driven up the cost of healthcare, because people started trying to buy a product that could service everything, even though it was only needed by maybe 2 employees that were hired in San Francisco and 1 in New York, right? So it drove up the cost for everyone else who was seated maybe in a smaller geographic area. And I think that that's parts of healthcare that people don't understand. And it's very complex. There's lots of rules and regulations and compliances for employers. And so you have to have the right type of partner in here helping you make those decisions. I still think a broker is key in this equation. Brokers are going to help you. Brokers with the right motivators are going to help you pick the right product for you that is going to drive the right cost savings. They're going to help you see those trends that are coming your way. The brokers that we work with, they've been bringing ICHRA to the table since 2021, right? And so they're innovative and they care about their clients. They've saved their client dollars. There are brokers for sure out there that are not caring about saving their clients money because it takes money off of their paycheck, right? I mean, and those
different motivation. They have different motivation. If you have a third party, remove all that emotion out of it, or that need, that motivator, then they will have the best interest of the patient
so
or client.
Moving to transparency is important. The other thing we didn't really talk about is I have a daughter who's a doctor. She's a 4th-year resident here in Kansas City, and she has taken on, near $300,000 in student debt to become a doctor, right? And on the other side, we are really compressing physicians. The carrier payer is compressing physicians, and it is so expensive to become a doctor, and it is so, I cannot imagine going through what she's gone through, and you're at the mercy of moving wherever your residency was accepted. And, everything is defined for you basically. And you really have to have a passion to care for humans, because you're now going to be pushed around by that large carrier for your bill. You're going to be told that your patient doesn't need the test that you think they need for their health. Your patient's test is going to be declined. You need to be able to give them the right type of medical care. If a diagnosis isn't found, you can be sued. But it's much like where benefitbay sits in the middle, where we don't control a lot of this ecosystem, but we're here to try to make it better. Your provider, and being able to see your provider and your advocate provider, should be your number one decision in your decision of what type of healthcare program I'm going to choose. If your HR manager makes that decision for you and changes carriers and you've lost a doctor, it's an average a 9-month wait to get into a new primary care provider. They also aren't going to get the test you need to get up to speed approved by a carrier, right? You have to have met so many boxes. So that part of the healthcare has gone down while the costs have gone up, is because they're working with kind of these handcuff rules all around them to provide the care we need. And then we're going to then hold them accountable when something happens as a patient, right? And so I think it takes the utmost drive to become a physician in America right now, with all of those restraints that they have coming at them.
Yeah, absolutely. That you have such a wealth of knowledge around this, and it's really insightful to know the different angles of this and how it is progressing. And I'm glad to hear that there is progress made, because you have the full picture around it. Tell us a little bit about your morning routine as we get closer to the end here. How do you get up, dress up, and show up? How do you do what you do? You consume a lot of knowledge, I imagine, just to know what you do know with laws and regulations and all that. But let's talk about how do you show up?
Yeah, how I show up, I think it's really important in remote work. And so this is key to a morning routine, I think, in a remote office environment, is to behave as if you're going to an office and you're going to be in public with lots of humans, right? And so don't take a step back because you're working remote to where you're not investing in taking care of yourself each morning. You're not waking up with that morning routine of, I'm going to get dressed nice for, business casual or whatever it is that is for your work environment. But you need to get up and you need to be able to face that day with the type of energy that I'm ready for my day. And how better to do that than, for me, it's got to be shower in the morning, and it's got to be, do the makeup and the hair, and, pick out some cute earrings and wear a dress and some shoes. And no one sees me from the waist down. And I could get to where I'm really comfortable and I'm wearing sweatpants and flip-flops, but it starts to convert over to other parts of your day when you don't start it with that level of drive and passion, and you feel better about yourself. right?
Mm-hmm.
You feel ready, you feel confident, you feel more energized when you take those steps. And so I think that that's key for me. Coffee's key for me. And also a couple of days, it's not a week because I don't right now as a startup founder, you work a ridiculous amount of hours. So I find myself on earlier and earlier and not having the time, but getting out of the house a couple of days a week and what I call my fake commute. So whether it's to go to a Starbucks or just to the quick trip, in Kansas City, quick trips are fun, to get an iced tea. It's for me just getting out of the basement, right? So getting around humans, that's something that I need once in a while. And if I found myself in this basement a lot with not that many out of basement meetings, so mostly on Zoom, or it can be emotionally draining. The most introverted person still needs to get around a human once in a while, right? So getting myself out there is important. I used to, for a lot of years, do the gym in the morning. I have found, and I'm 48 here in August, so I have found as I get older, I have less energy to do the gym in the morning. And so that is something that has gone away from a routine from me. I wish I could still do that, but it's just something for me that has had to shift to a later time of the day for me to be motivated. But again, same thing though, even though it's not in your morning, make sure that you're still taking care of yourself. Don't let it go. Startup founding is hard. Starting something new, being an entrepreneur, even if you're just trying to drive change in your community or make the world a better place in any place. If you're taking on something that heavy, you got to make sure you're still investing in yourself so that you can have that to give or to fill up that cup for everyone else. So for me, it's all about that coffee or that caffeine, which is, just a little crutch that I've developed over the years, but also making sure that I have done my hair and, the makeup and the whole thing and add that little spice that's a little bit about your personality.
I love that. When you look good, you feel good.
You feel good.
You show up. Yeah. Brandy, thank you so much for sharing. I love that insight. Tell us, how can we connect with you? Where can we find Benefit Bay? Where can we find you?
Yeah. So Benefit Bay is on LinkedIn. I'm very active on LinkedIn. You can find me on LinkedIn, or I did start a Twitter, Brandy Burch CEO on Twitter. And then I would say the most content that I share is on LinkedIn. I tend to, share regarding ICRA or regarding benefits and things that are going well or where I'm going to be or speaking or anything like that. But all things ICRA, I would say follow Benefit Bay. Also, we have a great website that's very resourceful that helps you as an employee have those speaking points with your employer and then helps your employer research it if you have a conversation with them.
Fantastic. Brandy, it's been such an honor. Thank you so much for joining us today and sharing.
Yeah, thanks for having me.
Amazing.
All right, morning enthusiasts, that's it for today's show. Thank you for tuning in. If you love the Best Morning Routine Ever podcast, we'd love to hear from you. So go ahead and subscribe, rate, and give a review on iTunes or Google Play. While you're at it, tell a friend about the show. Be sure to visit bestmorningroutineever.com and our Facebook group to join the conversation, access the show notes, and discover our fantastic free bonus content. Until next time.